Okay, so part 6 of this is kind of a wrap up of everything, and it's, again, the whole 2020 approach and trying to practice or adopt a new lifestyle of wellness in 2020. So this component is about defending yourself. So there's a lot when I talk about self-health and things that we can do on our own to boost our health, boost our immunity, boost our wellness, so we don't burden the system. The system right now is obviously overwhelmed with what's going on. And who knows when things will change and end. I mean, they talk about right now, we're on a second wave of things happening, and there's just a lot of misinformation out there. So these are things based on science and facts that I have used for years, and I continue to coach my clients on ways to boost your defense and support your body, not only now, but long term. Could be, not just an acute illness, but chronically, things that really help you to cope with hard times. So we're going to, this chapter 6 is about defense. Now, looking at this, pandemic and just in general, there's a lot of risk factors that we have with this virus, but also just in general. Like, a lot of people haven't thought about people with heart disease and cancer and diabetes. Those things are all still happening, and we're still having lots of health problems in this country with chronic illness. An acute illness being something like this virus and things like that can obviously send you over the edge, right? I mean, unfortunately, there are many people that have perished because they've had pre-existing conditions, and it's just too much for their body, and unfortunately, they've passed on. So there's some of these things that I'll talk about that are things that we have a bit more control than I think we think about, and ways that we can, control them a bit better, and hopefully, if anything happens with a chronic or an acute illness, that we have the ability to fight it a bit harder than most. So look at risk factors. Obviously with COVID, age is a big thing. People 69 and over are very high risk, so your risk levels definitely increase with age. Someone with cancer obviously is already fighting something, and adding to that can obviously be deadly. Chronic kidney disease, someone that's on dialysis, which is a horrible thing to have to actually go through, is also at a increased risk. So these risk factors are things that, these things, obviously we can't change our age. Cancer, we can fight as much as we can. Chronic kidney disease is something that's very difficult to deal with. So these are things that some of them we can't really change, right? We have to resort to therapies and drugs and things to do that. Asthma, COPD, again, things that we rely on oxygen and different drugs to try and help us manage these chronic conditions. Heart conditions, heart failure, coronary artery disease, cardiomyopathy, these are all, happening, and people having to deal with that, plus this acute virus can be very deadly. Someone that's in an immunocompromised state, let's say someone that's had an organ transplant, is also going to have immune system issues or weakened immune system because of that. The main one, the first one to look at is obesity. Okay, so that's one thing that when all this stuff was happening and it was working its way to the U.S., is that was the biggest risk factor, controllable risk factor, that our country had that other countries didn't really have as much of a problem with. And that is obviously shown. I mean, someone that has excess body weight or a higher BMI is going to have, less health, right? Less well-being. If they're already kind of dealing with something outside of an acute issue. It's a chronic health issue. So obesity in this country is definitely a factor that we need to address more. And I think obviously with this virus, people have focused a bit more on that, trying to be healthier, because that is a risk factor that you can control. So the more educated you are on that, the more you can apply ways to improve your BMI or your weight or your body composition, the better capable you are to handle something like this, right? So that's one of the factors we're going to talk about. Sickle cell disease is another thing, which obviously you're going to need treatments for. and therapies, and hopefully you have that under control. Smoking, obviously this is a lung issue, right? It's a respiratory infection. It's a virus that takes over our respiratory cells and replicates itself and produces lots of fluids, and it makes it very hard to breathe for anyone that gets it, youth to obviously senior. So smoking, whether you're vaping, which obviously is a big thing now, I mean anything that negatively affects your lung function and creates more toxins and more overload. If you're working around any type of noxious fumes and things like that, that's all very difficult for your lungs to handle. Then on top of that, having this could be obviously a death sentence, unfortunately. And then type 2 diabetes, right? Controlling your blood sugar. Those are things that we really need to address, especially considering this acute virus which has overcome the world. So these three things here, obesity, smoking, and type 2 diabetes, are very important things that we can look at and address and reduce some of our risk. Some of us already have these things, some of us may be moving in that direction with obesity or diabetes, and these are things that I think we need to really address and have more self-health and responsibility for. So let's look at your immune system, your lymphatic system. Okay, so I talked earlier about activity and exercise and the effect on health, but this is more focused on your lymphatic system. So your lymphatic system is basically this whole network of tubes. Okay, so what they actually do is you have lymph, which is basically clear fluid which flows through these these vessels. Okay, but what actually pumps them is your skeletal muscle, and movement moves this around your body. Okay, so it picks up excess little bacteria and viruses and things like that, and actually circulates them back to your lymph nodes, which are typically in your hips, your armpits, around your neck and things like that, especially if you're getting sick and you feel your lymph nodes, your doctor feels your lymph nodes. Those are areas that are almost like a cell, like an entrapment, like a jail cell. So basically your lymphatic vessels, through muscles and action of movement, pumps this lymph up, it goes to the lymph nodes, and that's where your immune cells are there, and they basically break this stuff down and get rid of it, right? So if you're getting sick and you feel your lymph nodes kind of swelling up, I mean that's because your body is pumping through your lymphatic system and moving these things into areas where they can be eliminated. So supporting that is very important. And again, activity and movement is a primary driver for this. Those cells, the immune cells, require other nutrients and things like that, but primarily moving this lymph is the first part, right? Getting up and moving as much as possible, circulating your lymphatic system. That's why if you're in the hospital, they want you to move around and get moving because fluids build up in your ankles and they want things circulating, right? So for the most part, when it comes to your lymphatic system, in order to support that, you want to be active. Okay, and this doesn't really require hard exercise. It just requires a walk, moving around. Okay, that improves circulation, especially in your lymphatic system. So this is the first component to talk about when it comes to boosting your immune system. Activity will boost your immune system because you're moving the lymph around your body. You're collecting these foreign bodies and you're getting rid of them. You're eliminating them. Okay, the second thing, especially when it comes to this virus, is lung health. Right? It's known to attack the lungs, replicate itself using our cells, create fluids in the lungs, and all types of issues. So you have your upper and lower respiratory system. Upper is going to basically be your nose, throat, all that good stuff. The lower is going to be your lungs. Okay? So when we look at your respiratory system, we're going to divide it into two areas. So sneezing and coughing or expelling is a reflex. Okay? So that's one way to force things out of your respiratory system. So flushing things out, so blowing your nose, sneezing, coughing things up. Mucus collects that stuff. Mucus and phlegm basically collect all this different, these invaders, and the meaning of that is to basically kind of like trap them and get them out of your system. Whether you blow them out in a tissue, or you swallow them. Those things, we actually swallow quite a bit of bacteria and mucus, which doesn't affect us because it's being eliminated through our stomach. But basically getting rid of them, whether it's through your nose or coughing or sneezing, those are ways our body's reflexes act, right? We don't think about, oh, I want to sneeze. It's a reflex. Your body senses something and it tries to kick it out. You cough. Coughing is just a natural response because the small hairs in your lungs sense that there's blockages. So see, these are natural reflexes that happen with our body. One of the big keys to mucus and phlegm is we need to have adequate amounts of water. If you're dry, that's why we have a lot more colds and things in the winter here in Western Europe, because the air is dry and it dries out our mucus linings, and then this bacteria and whatnot and viruses can get into our cells. So primarily it's kind of like a cushioning system or protective layer around our cells to entrap things and then get rid of it before it gets into our cells. So it's very important, like I said, to get adequate amounts of water, especially in the winter where things are dry, to really fuel the mucus and phlegm to get rid of that stuff, right? We also have, obviously, nasal hair and lung hair. There's actually little tiny hairs in our lungs that actually are constantly kind of beating and pushing things out. So when we breathe out, it's kind of flicking those particles out as well. So when you're exhaling, you're actually exhaling all these little particles. And then if you're a cough, it really forces all that stuff out. I mean, a cough can be very powerful. Obviously sneezes as well. That's why the whole 6-foot distancing, because the sneeze can go very far, especially the droplets. So our body's trying to entrap these things in droplets of mucus and water and expel them and get rid of them. So it's one of our natural defenses. So making sure you have enough water is crucial to that. There's also specialized macrophage in your lungs, white blood cells, which actually go around and kind of take care of some things that are hanging out in our lungs. And these are the things that we have to be very careful of with what's called a secondary respiratory infection, in that's a common thing that will happen as you're fighting an illness, is that a secondary infection will set in, and then your immune system comes in full bore and unfortunately a lot of times kills healthy cells and can ultimately be fatal. Humidity and steam will actually keep your lungs moist. So one of the things that is recommended is having a humidifier or taking a shower with steam. That actually helps with moistening the lungs and helping rid your body of some of these excess invaders and things like that. So those are keys to lung health. Now another thing we kind of talked about a bit was your microbiome. But basically there's a lot of bacteria in our digestive tract which help to improve immunity. So our gut is basically our first immune system. So if you think about your body is actually, as we're developing in the womb, our body is a tube within a tube. So when you eat food, it's actually not in your body. It's still outside your body, but it's in your digestive tract. So in order to get into your body, it has to pass your gut wall. So there are specialized cells and bacteria that actually help us with protecting from toxins and invaders getting in through our gut wall. It's like a big defense. With this, with COVID, it's more of a lung issue, right? In your eyes and nose and mouth. But these components are very important for overall health. So gut health is obviously very important. Nowadays you see a lot more with probiotics and prebiotics advertised in different foods and supplements and all this good stuff. So this is supporting these bacteria which help keep us healthy. Because again, they outnumber us 10 to 1 and they're symbiotic with us, so they help with a lot of functions in our body. Okay, so now we get to vitamin therapy. Again, something you're going to use to prevent illness, but also if you get sick, whether it's a chronic or acute illness, these are things that your body uses in larger quantities to keep your body, to help eliminate things. So first of all, vitamin C, ascorbic acid is pretty much the same from every supplier. It is some of the cheapest stuff you can ever buy, and it's very effective, not just for cold and things like that, but your skin, hair, nails, all that stuff all needs vitamin C. It's something we need to take in consistently because it is water soluble. We can't store it. We'll go into more detail on each of these after these next couple slides. Vitamin D3 is something your doctor will check. In Western New York, we do have an issue with people with a lot of D deficiencies. And they can obviously test you for that and recommend some basic supplements that are also very inexpensive to boost your D levels. And D is very important for your immune system. Very important. Now these are going to be measured in international units, typically in 1,000 international units. Sometimes if you have a very low amount of vitamin D, they'll give you like 50,000 IU to boost it. The next would be zinc. Zinc can be used in a supplement form and/or lozenges. It also helps a ton with your immune function. Magnesium, as I said, is also very important for bone density, but an important component to your immune system fighting things off. Water, as we had talked about, is essential for flushing things out, but also all chemical reactions in your body happen in an aqueous solution. So if you're dehydrated, some of these reactions don't happen and your body cannot properly produce reactions. Also, obviously, the more you're blowing your nose and sneezing, the more water is coming out of your body. As the temperature changes and you're outside and you see you're talking, you see the mist and coming out of your mouth, that's the amount of water that's pretty consistently coming out of our body. More in the winter, obviously, because things are so dry, but that water vapor is coming out even during the summer, not at the levels that we see in the winter, but everything is taking water from you. Green tea is excellent. It's, again, one of the simplest and cheapest things to use for antioxidants, things that actually sacrifice themselves to help rid your body of free radicals. So these are some of the things I look at, and they're very inexpensive. I don't sell any vitamins. I do recommend using them. I personally use them and recommend them to my clients as well to boost your immunity. So let's talk about vitamin C first of all. So it's ascorbic acid. It's all the same. There is buffered vitamin C, which in case you have, because it is an acid, if you have any type of stomach acid problems, sometimes like an ester C, as it's called, can be used, which basically they just cut with baking soda, so it's not as acidic. It's a very powerful anti-inflammatory, antihistamine, great for allergies, great for arthritis and things like that. Antihistamine for, again, allergies and things. You want to take it, typically it's going to be 500 milligrams at a time. You do not want to overload your receptors, meaning that if you take too much vitamin C, your body can hold on to it and just flush it out. Okay? So usually 500 milligrams at a time is the most you want to take. Now you could take that several times a day, and I do recommend taking it breakfast, lunch, dinner with food. Typically all vitamins are going to be taken with food, but they are water soluble, so your body cannot hold on to them. You do want to avoid chewable vitamin C because it is very caustic to the enamel on your teeth. So if you're chewing vitamin C and it's kind of grinding down into your enamel, it can actually start eating your enamel away. So important thing, if you do use chewable vitamin C, if you can't swallow them, you can either use like a powdered form, or if you do, you can just brush your teeth right after and rinse to try and get that off your teeth. Now, there's a thing called bowel tolerance with vitamin C, which is you can never really overdose on it. If you take too much of it at a time, you just get bowel intolerance. So you get some type of like mild diarrhea, which again, it's just temporary, but it's very powerful stuff, and typically it's going to be much higher doses to hit any type of bowel tolerance. So typically talking with your doctor is obviously very important for any supplement, but this is probably the most generic and limited side effect vitamin out there. So typically between 1,000 and 3,000 milligrams a day divided into 500 milligram doses is what's recommended. Like I said, you can't really overdose on it. These are just small levels. They do use it in certain countries for cancers. That's going to be more of an IV drip, but those are much, much higher levels. And it is very effective, but very inexpensive and very effective. Okay, so D3. This is one thing. Go to your doctor and get tested for it. It's a very simple test. Most of the time it's covered under insurance. Vitamin D3, which is a derivative of D, is very important for our immune system and obviously bone health. So when sun exposure is limited in the fall and winter, we have less D production because it's mostly made in response to the sun and light. Here in Western New York, we have a lot of issues with seasonal affective disorder, where it's affecting our mood and it's dark and we don't have as much sun. So it does actually help to increase your moods and stabilize them. K2 is another vitamin that's sometimes taken with it to increase your uptake. Just because you're taking this, whatever recommended dose by your doctor, doesn't mean you're actually absorbing it. So sometimes if it's mixed with K2, that will increase your uptake and boost your levels. So when you're tested again, it's shown in your tests. Okay, so zinc is very important. It's found in cells throughout the body, helps the immune system fight off invading bacteria and viruses. So this form is basically just a lozenge. So this would help with the mucus lining. It's something that, again, helps flush things out of your body. It's kind of toxic to a lot of bacteria. But you can use it in a supplement form as well, or lozenges. Especially now because of everything that's going on with this respiratory viruses, it's great to increase that amount of zinc in your body and mucus to help kind of block those things. 20 milligrams a day is what's recommended if you use the supplement form. If you're using a lozenge, they're typically going to be much less than 20 milligrams, and it really depends on what you're using. But there's a lot of elderberry as well is another thing that's good to stimulate this mucus response. Okay, magnesium. Like I said before, magnesium is very deficient in the U.S. diet. It helps keep the immune system strong and strengthens muscles and bones. One simple thing that works really well to increase your magnesium levels is Epsom salt. If you soak in a bath, especially if you have sleep issues and things like that, it helps a ton with that, relaxing your body. But it's very important for your immune system. If you don't want to take an Epsom salt bath, you can do a foot bath, so you don't have to be totally immersed in it. You'll still absorb it that way. But also if you take a supplement form, typically 400 milligrams a day is what's recommended. Again, with all these supplements, speak with your doctor. They'll give you guidance on this. Sometimes there might be an interaction with certain things if you're on any medications, but always speak with your doctor about these levels, and you can be tested for most of these things as well. So your doctor could do a full panel and test these things. Like I said, vitamin D levels are very commonly tested, and most people test to be low. Okay, so again, coming back to water. Water is very important for all these different purposes, right? I mean, most of what we talked about today, water is essential. It is a macronutrient. It's something you need in large amounts, at least 64 ounces a day. Yes, you are probably going to be in the bathroom more often, but that also means you're flushing more things out, okay? You don't want to gulp water and guzzle water. That'll make you have to go to the bathroom much, much more frequently. If you have a water bottle, sip it throughout the day, but try and finish a certain amount of water so you kind of know how much you've had for the day. The most important is, like I said, in the winter, you want to increase the amount of water you're drinking because, like I said, everything is dry, everything is taking moisture from your body, and you can see it in your skin. Another way you can see if you're dehydrated or not is you kind of pinch your skin like this and it doesn't pop straight down. You're probably a bit dehydrated. If it stays up before it comes down. It's a little test, nothing super scientific, but it is accurate. Okay, so green tea. Again, like vitamin C, green tea is even cheaper. Most of the green tea you can get in tea bags are very, very cheap, and you'll get them with mint and different flavors added to them. But they have a ton of what's called green tea extract, which is a very powerful antioxidant. You want to use this brewed, not bottled. So a bottled tea like this, even though it says it's brewed tea, those antioxidants break down. Okay, so if you don't use them when they're fresh, they're a lot less effective. Plus, things like this, I mean, it's a powdered form of it. It's typically mixed with all kinds of high fructose corn syrup and sugar. So teas are a big thing because, you know, the drink industry knows that people like to drink tea and it's an alternative. But a lot of times, actually, the tea with different sweeteners in it actually has sometimes more sugar than colas and sodas and things like that. So you have to be very careful. Don't just think because it says it's green tea and it's natural, it's going to be healthy. That can easily be changed quite a bit. One thing to look for as well is honey. Local honey typically is going to be very great for allergies, especially this time of year, but it also is very good for coating your throat. So again, that's going to entrap some bacteria and viruses and things and flush that down into your stomach. So that's also another natural food that you can use. Some of it gets pretty expensive, but it is very effective in tea, but also if you use it aside from that to kind of, you know, lubricate your throat, that does work very well as well. Alright, so just to kind of wrap everything up, and this is going to go along with the handouts, is goal setting is very important, but I like to ask 3 questions. What is it you want to start doing in terms of your health? What do you need to stop doing? And what do you want to continue doing? Developing SMART goals, and SMART goals have been used in all different types of business ventures and things like that. But developing this stuff is the most important way to make a clear and defined goal. Okay, so it's got to be specific. What do you specifically want to do for your health? How do you measure it? How do you set goals, and how do you see where you're at in terms of attaining those goals? Attainable. They have to be things you can attain. Right? It can't be some outrageous goal. I mean, there's a lot of small things, small changes over time make a big difference. It has to be realistic, right? It can't be some far off thing. And time bound is probably the most important. You need to have set times to do something. You need to set your own deadlines. You have to want to be here at a certain point. Tracking your progress is very, very important. So this is part of the handout that goes along with this presentation. The next, right now, I love to use this analogy and perception for it, because right now we don't know how things are going to be. During the research for a lot of this, there was so many changes on what's going on with COVID and pandemic. So the main thing is we don't know what's going to happen from here on out. I mean, right now, currently, we're on our 2nd wave in the U.S. But I always look at perception forward. So meaning, looking at your windshield versus your rear view. Your rear view is what you've learned. This is your past, this is your experience. And really what's in front of you is wide open. Right? So looking through your windshield versus your rear view mirror, this is your experience, this is opportunity. So we don't know where things are going right now, and it's important to keep that perspective. So the summary of kind of everything is you need to support your immune system. Your immune system is what keeps you healthy. Drugs and things like that and vaccines can help to eliminate, but basically your body is going to be doing most of the work. So supporting it in all these different matters is crucial to your survival. And again, this course is based on survival. Providing your body with the nutrients it needs, again, vitamins and minerals are essential to support a strong immune system. I in illness versus we in wellness. You need a team. You need a whole series of people to work with you to attain optimal health, especially in this day and age. So I hope you've learned a bunch from this presentation. Again, there'll be handouts that go with this because there's been a lot of information to go with it. But I hope you have learned something that you can apply that's going to help you down the road and today. And if you have any questions, feel free to contact me. My contact information will be on the handouts. And thank you for listening.